babangon tayo. Sama-sama lahat ay susulong. Basta't tayo'y magtutulong-tulong. Lilipas din, matatapos din ang dilim. Manalangin, 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 matatapos din ang dilim. Manalangin, 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 matatapos din ang dilim.
Lahat ay may magagawa, magbigay, magpaubaya, palitan ng alitan ng pag-unawa.
Malay mo bukas makalawa. Ang hirap ay sama-sama natin hinaya. Paano kung tayo'y magkaisa sa panahong kailangan ng isa't isa?
Hanggat may nakikinig sa panalangin, di mawawala ang pag-asa natin. Ikaw at ako, babangon tayo. Sama-sama lahat ay susulong. Basta't tayo'y magtutulong-tulong. Lilipas din, matatapos din ang dilim.
Manalangin, 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 matatapos din ang dilim. Manalangin, 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 matatapos din ang dilim.
Basta't tayo'y magtutulong-tulong. Sama-sama lahat ay susulong. Di mangangamba, di matatakot. Matatapos din, lilipas din ang dilim. Basta't tayo'y magtutulong-tulong. Sama-sama lahat ay susulong. Di mangangamba, di matatakot. Matatapos din, lilipas din ang dilim.
Basta't tayo'y magtutulong-tulong. Sama-sama lahat ay susulong. Di mangangamba, di matatakot. Matatapos din, lilipas din ang dilim. Manalangin, manalangin.
Bayang mabiliw, pelas ng silanganan, alam ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyan ka ng magiging, sa manlulupig, di ka pasisingin. Sa dagat at bundok, sa simoy at sa langit mong bakaw, may nilagang tulad namin sa paglayang minamahal. Ang kisag ng matawad mo'y tagumpay na nanininig. Ang bituin at araw niya kailan pa may di manililig. Lupa ng araw ng walang ipagsinta, buhay ay langit sa piling mo. Aming ligaya na pag may mga api, ang mamatay ng dahil sa'yo.
Good afternoon, and again, thank you for joining us this afternoon. I will be moderating this session, but of course, I will also take part on the discussion later. So my name is Kevin De Vera. I am the interim director of GM Academy, likewise the secretary of GM Bicol. And this afternoon, we are expecting for this session to be recorded, as we want also this to be posted later on our website. So a bit about GM Bicol. It is a community-based organization based in Daraga, Albay, and its core projects and initiative is focused on um, focused on really trying to bridge the gaps in HIV services, especially in advancing sexual and reproductive health. So we started as a group of volunteers, actually, to be very specific, youth peer educators at that time. So it existed for close to 7 years now. And we continue the work as we see the need to continue working with communities and local government to try to achieve a more inclusive society wherein the marginalized are also part of public decision making. Of course, if I may also take the opportunity to introduce Gayon Albay. Gayon Albay has existed for more than a decade already, and it is an LGBT movement organization which basically headed the transformation of inclusivity in the Bicol region. It is the first community-based organization in the whole country to advocate for anti-discrimination policies, which unfortunately did not realize, but their story actually, and in fact, inspired other local government units to start their own anti-discrimination policy, like the story of Cebu City's policy on anti-discrimination was actually a result and inspired by the movement created by Gayon Albay in Bicol region. And of course, Academy of Political Management is a fellowship by Friedrich Ebert Stiftung. It is a German foundation which is supported by one of lead political party in Germany, which presents different progressive ideals on how to make an inclusive society wherein no sort of dictator will rise in power again anywhere in the world, as German people experienced during time of Hitler's. Now, yeah, no, first I'd like to hi people who are with us today, and I see familiar people. Thank you so much for joining. I'd like also to acknowledge a few mentor who I owe my education at the same time my training to them. I see here also a few faculty of nursing from Bicol University. Flex ko lang at shout out Ma'am Roan. Yan. So happy to see you here. Yan, I owe you so much also growing as a professional nurse. Ayan. So
Hi,
the first
Kevin.
topic, hello po. The first topic actually is a study. It is a research conducted on the onset of the pandemic. The second topic will be given by a representative from Gayon Albay, which is about the um, volunteer experience on making an inclusive society. And the last presentation will be by uh, a nurse who works closely with clients who would want to get HIV screening and clients who are already living with HIV. So let me just try to set up my presentation. There. I'm not sure if you can see it. May I ask our audience to raise a hand or send a chat if you can see the presentation, please? Thank you. Thank you so much. So the first part of the discussion is about the PLHIV situation during the onset of COVID-19 pandemic and ways to move forward. This study is conducted by GMB call headed by myself, and this was actually a response to the dire call of the PLHIV community that they are facing a lot of issues during the onset of lockdown. So a bit about of introduction. Due to COVID-19, alarming rate of cross-infection, which resulted most societies in the world tried to immobilized transportation, socioeconomic activities. So basically, it impacted the lives of many. And in the Philippines, at around March, actually at around January, February, we started getting reports of um, COVID-19 transmission coming mostly from outside the country, and we had our first case recorded in Cebu. So at March 16, 2020, finally the government imposed a mandatory Luzon-wide lockdown. So this lockdown, as you can still remember, impacted the lives of many, like the students, especially those who are informal workers, no, and what we don't know and what we don't usually hear is that this wall that is meant to protect the public and keep everybody safe serve as a wall stopping people living with HIV from getting their life-saving medications. So these are the the HIV medications or the antiretroviral drugs. So who are these people living with HIV? So they are immunocompromised individuals. So basically rely on their antiretroviral medications, which is part of the ART or the antiretroviral treatment. So imagine a person who is already immunocompromised, and at the onset of the lockdown or the community quarantine, they now have a dilemma of how exactly they can get and access their life-saving medications. Putting the lives and health needs of PLHIV in the context of COVID-19 pandemic, we are actually looking at a 45,000 people who are enrolled in HIV antiretroviral treatment. And these people have been impacted primarily by barring them down to travel and access their antiretroviral drugs. Where do we get these antiretroviral drugs? To give context to our audiences, in Bicol region, at the onset of the lockdown, we only have very few treatment hubs where they can access these medications. So this is the Bicol region. And if you can see, apart from the mainland geographic feature of Luzon, we also have two island provinces and a number of municipalities which are islands. So Bicol region is a home for over 1,000 person living with HIV, and 761 were confirmed and recorded with the DOH who are enrolled in antiretroviral treatment. So because of the lockdown, there are 761 people across the region have been impacted by the immobilization and stopping of transportation. A lot of literatures also suggested that we're looking at a dilemma wherein there can be existing models also that we can follow. So I would like again to remind everybody that in this context of the study, it happened during the first 3 months of the lockdown. So according to international perspective on sexual and reproductive health, sexual and reproductive health will also be affected by societal responses to the pandemic, such as local and national lockdowns that force health services to shut down if they are not deemed essential, as well as consequences of physical distancing, travel restrictions, and economic slowdowns. Well, in fact, true enough, it happened to the people living with HIV, as most of um, health services halted and shifted towards COVID response. Even in Bicol region, we see a lot of situation wherein social hygiene clinics were forced to divert its health human resources to other responses that would actually work on COVID response. Even before the pandemic, the problem here is that HIV/AIDS services and programming have already been lacking. Country efforts have been insufficient to reach targets on testing, diagnosis, antiretroviral therapy, and a lot more. However, we can see that civil society organizations have been playing a very big role in providing support to bridge the gaps in government HIV programming and services. So where are we now? So during the onset of lockdown, at this stage of the pandemic, we are yet to see the impact of COVID-19 protocols, travel restrictions, lockdowns, and shift of health human resource to COVID response. However, it is the right time also to look into the lived experiences of PLHIV, which inspired our organization to do a quick and responsive study, understand their situation. Ultimately, this study were opted to develop possible measures to recommend on how to improve the HIV programs and services along the lines of their needs. So the challenges, um, uh, this study primarily focused on exploring the lived experiences of person living with HIV, specifically to get these questions answered. So how exactly is the people living with HIV in the Bicol region living? So what is their situation? What are the challenges faced by them? And what sort of actions or measures or mechanisms that have been manifested or observed, no, in their daily lives, starting uh, or at least from the start or onset of the lockdown, and to come up with possible measures and recommendations that can be drawn from those experiences. So a bit about on how we did this study. It is an exploratory phenomenological inquiry. So for those students who are about to start with their thesis, no, you may also want to I'd be very happy to share the full paper of the study just in case you want also to do the same study. So exploratory phenomenological inquiries, basically we want to understand what unseen situations are in the basis or in the context of the lived experiences of people. So that is what it is about. So this study adopted the McLeroy's ecological model for public health promotion, and this is how we adopted the model. And one-on-one interviews with 8 persons living with HIV scattered all around the region, and 2 key informants using online means were also done to check and validate their claims. Um, we made sure that confidentiality of all the participants, especially the people living with HIV, are protected, and their private information and details about where they live, who they are, were made sure to be dealt with utmost importance. So as you can see here, in the framework that we did, no, we wanted to look at the lived experiences of person living with HIV and use the ecological model, especially in understanding their situation, understanding the challenges faced by this population group, and understand how so far they are adapting to the situation amid pandemic, including all the support they get from the level of the individual, family, community, and so on. And then the measures to be recommended. So more of a situation, access of PLHIVs to HIV program. These are now the results. No, so far during the onset of the start during the onset of lockdown, during the conduct of the study, all participants shared that means of getting HIV services is to go directly to their respective treatment hubs. So if a person, for example, is living in Masbate, which is an island that will take you hours to get to the mainland Luzon, which is a port somewhere in Sorsogon, you need also to travel by land going to Legazpi City to get your antiretroviral drugs. So it would be an estimate of, it depends on the weather and availability of means of transportation, it would cost you around 4 to 6 hours from your residence going to the nearest treatment hub. So imagine the situation of people living with HIV who were barred down of access because of the lockdown. While most participants shared that they also get services from CSO groups, but major services like getting their medications, treatment, like there are person living with HIV have tuberculosis or other opportunistic infection, they all get those health checks and treatment from their treatment hubs, the likes of Bicol Regional Training and Teaching Hospital and Bicol Medical Center. Social services, however, according to two participants, can be accessed from the local government unit of their residences. So, in the present time of COVID-19, their link to their usual point of services are through text messaging and online means. And when we try to understand how responsive social and health services, if they access it through text messages and online means, their response was actually problematic, and they usually do not get a quick reply, to their concerns. Living and health conditions of person living with HIV. Most participants have health concerns in relation to their HIV status, which is basically related to their opportunistic infections. Most participants require access to HIV medications and other related treatment for current opportunistic infections, while a few participants complain about being laid off from work or barred from their socioeconomic activities to support their daily needs. Like one participant here is actually a mother of three and also the only earning member of the household. No, so it was a terrible situation for her, for a mother living with HIV and also rearing three kids, no, supporting three kids. One participant pointed out being alone in his residence, which is a boarding house, and he was caught by imposed community quarantine. So this is a student. One participant is a student who expressed his high anxiety at the same time, worrying a lot about his health, no, for being immunocompromised, away from the comfort of his family. At the same time, no more access to basic needs like food, etc., etc. If you also remember during the onset of the lockdown, even the most basic like carinderia were also forced to shut down. Not because of the policy, but because of halting the people. No, those businesses actually chose to just close temporarily because they don't have customers anymore. And such situation impacted um individuals like this one participant here who relies basically most of his needs from other social activities happening outside his home. So despite the need to access basic health services such as medical checks and other sexual and reproductive health services, laboratory diagnostics, these services aren't available too due to temporary shift of most health services to COVID response. Along the challenges faced by PLHIVs in Bicol region, they mentioned about their access to HIV medicines were severely impacted. All participants shared their concerns about getting their regular supply of their antiretroviral drugs or HIV medications. The imposed community quarantine stripped them the opportunity to do their usual travel to their respective treatment hubs to be able to resupply their medications. While one participant is seriously concerned about his situation because during the conduct of interview, he only got three more days worth or supply of his HIV medicine. So this one participant really expressed his concern, and I remember while talking to him, um, he also made mention about how many times he tried to contact the health services, the case managers, the people who are supposed to help him to get his HIV medication, was like telling him that they got busy because of the shift of workload towards COVID response, or the health services were contaminated or got infection. So health services at that point in time was temporarily shut down for the contamination. This stands to service providers and facilities were also found salient, no, during this conduct of study, where most participants shared that there are quite far from HIV services and facilities. One participant is relatively near however, would still require to commute to reach the nearest facility to him. And if I can recall the exact description as he tried to describe how he gets to um, the treatment hub, he needs to take at least 2 jeepney ride and 1 tricycle. But with the transportation ban because of the lockdown, no, he has no means of going to the treatment hub anymore, despite of being near to the facility. Another participant who is in a special situation shared that he got trapped or got locked down in a place outside Bicol region. So if I may share without trying to identify this person, he got trapped in region 4A. So while in a holiday, no, and in region 4A, the imposed quarantine, no, was declared, and he has no way of going back home to Bicol. And his concern was very much the same, how to access his antiretroviral drugs refill. So there are also other PLHIV who were displaced by ECQ, and due to the distance to their treatment hubs, had concern about getting the refills of HIV medicines. A lot of the participants shared the level of their stress related to financial problems and food supply. So apart from their concerns that the COVID-19 is a real serious threat to their already immunocompromised health, they also shared a lot about financial concerns and concerns about food supply. So all participants expressed feelings of some extent of getting stressed along in terms of financial stability and getting the supply of their food if they ran low. Although there were also a lot of ayuda or relief packs being distributed, but they describe it to be not enough for to support them, no, for the period or duration of lockdown. Some participants particularly expressed getting stressed about the budget they're getting for medication, since they were now cut off from getting their free medicines from public health uh, facilities. Some of them would resort to getting or buying their own medications out of pocket. All participants shared that they have received food assistance, which is also a good thing. However, some of the participants expressed that this is not enough. Along the lines of coping and adaptation, a number of activities were shared by the participants on how they try to adapt to the new normal as we try to coin that situation, including the stress and anxiety that the pandemic has caused. At the individual level, all participants share that they hold on to prayers and faith to him, to be sensitive about the religion because they are not homogeneous in terms of religion, enable them to become stronger despite the threats of COVID-19 to their already compromised immune system. Most participants identified a number of activities which allowed them to calm their nerves and keep them straight on thinking on how to overcome. These activities include doing recreational activities, which is really funny because, it's very the same thing that most of us are doing. Like checking online courses, keeping pets, being a plantita or plantito, trying to cook or make I'm sorry, um, creatively preparing ayuda like canned sardines, corned beef, etc., into a new, more ano yan, more a happier version of canned goods, and learning a lot from these experiences and special mentions of TikToks. Like 4 of the participants mentioned about doing TikToks. So at the family level, all participants except one shared that their family does not know about their HIV status. Having said that, most of the participants only rely on themselves and few of their friends to talk about their situation. And most of the time, they would really seek to those counselors or peer educators that knows about their status so that they can also share what they feel. Being not able to openly talk about their emotions to their family members make it more difficult to figure out how they can help themselves in situations like getting their medicines, getting funds for what they need, etc., etc. Excuse me. So at the level of the community, all participants share that they belong to a PLHIV support group except for two others. So like 6 of them are part of a support group and 2 of them are not. So this support group is called GM Plus. GM Plus is actually um, a special arm of GM Bicol that provides support to PLHIV that help them to get access to their medication, get them counseling that they need, and so on. All the participants who shared that they are part of GM Plus expressed that they have found a safe place for them, which they can consider a little community, which they can freely express themselves despite their HIV situation. In this context, in the middle of the pandemic, this also allowed them to share their story, their struggle, and among themselves, enabled them to get thoughts from other PLHIV on how to win their struggles. This group also allowed them to connect to professionals, which they can seek medical advices. So GM Plus also enabled them to get their voices and concerns to proper authorities. One participant who is a GM Plus member shared that he got trapped in his house and no means to get his medicine refilled. Eventually found a Facebook page about HIV, and that is how we get make contact with him. So doing so enabled him also to find means on how to get his or her refill. Another participant shared the experience while being displaced by the quarantine through a friend. He got to connect with GM Bicol who operates in Bicol, and despite being in Laguna, he was able to get laboratory tests he need. So, putting all those together, the the results, using the ecological model on public health, no, we we presented the results in such a way that we can see interpersonal, intrapersonal, community and public policy level to creating measures or recommendations. So at the interpersonal level, um, it is very good to point out that in the intrapersonal level, all the participants are acknowledging the fact that they are in a situation that puts them in a very disadvantageous position, and self-acceptance is a very good start to promote mental health activities. At the same time, um, other supportive activities for them to be part of more conversations. This can also mean that we can start helping them to start the discussion of getting their status be known by the family, by therefore improving family support. At the same time, it was also found that peer support or PLHIV to PLHIV in one PLHIV community was also found very important, no, in really keeping the calm, at the same time in providing them emotional and mental health support, no, through support groups. Um, at the community level, it was seen evidently that community-based groups, community-based organizations has a huge role to play in terms of bridging the teening HIV and sexual health services. CBOs are recognized for their work, no? And while looking at the situation or engaging with the key informants during the conduct of the study, the key informants also acknowledged the fact that CBOs really assisted them a lot, no, during the onset of the pandemic, especially on making sure that the HIV or there is a clear list, no, or picture of HIV situation wherein the government can also find place on how they can respond, no, despite of the shift to COVID response. At the level of public policy, drawn from the information gathered and experiences of the participants, there would be a lot of policies that actually can be recommended here, especially like institutionalizing community-based organizations to be part of the service delivery network. At the same time, that this active community-based groups or existing organizations that has um, or are well grounded no in the levels of the community, um, can be given opportunity to really play a huge part no in addressing uh, those gaps. So the information gathered, basically there is a need to recreate an effective and efficient system of interventions to fill in the gaps of the severely impacted health system, as most LGUs and health services providers were shifted to prioritizing COVID-19. And health programs, especially services for PLHIV, should not be neglected in the process. No, let's go back to the context that PLHIV rely on their HIV medicines, which are often referred to as a life-saving medication, most of them. Um, there are a lot of opportunities as well, like creating and improving support system, engaging communities at the same time maximizing existing groups with strong presence in delivery of such programs. At the same time, government, sexual health, and HIV programs were made efficient in delivering its purpose with presence of community partners. So if it works that way, might as well ensure that they continue to do that by institutionalizing them to be part of a bigger service delivery network. Presence of support group under the management of a CBO like GMB Call, which is the GM Plus, added value to improving the state and living conditions where, well, which we can also put in a way that we can also say that somehow contributed to their well-being during the onset of the lockdown. So conclusion and recommendation, the findings of the study reflect the lived experiences of PLHIV and Bicol region who are impacted by COVID-19. So point of actions to improve the state of conditions along the lines of their health needs can be geared towards following these dimensions, which are intrapersonal in terms of um, really conduct of educational discussion to provide them skills and helpful information along the lines of their mental health, how to protect themselves with COVID. Because at this stage or at that stage of COVID-19 pandemic, no, most people really has no idea yet what COVID-19 is. That's why anxiety and fear no, is very high. And finding support group and developing personal ritual no or your own way on how to improve your relationship to self. Along interpersonal factors, we can go with CBOs and LGUs, collaboration at the same time, provision of technical assistance to its manager, providing capacity opportunities for PLHIV, and other training and education opportunities, which can lead to empowerment and later on can translate into leadership. And then at the level of the community, it may include mapping of more CBOs and CSOs. Because I know for a fact that GMB Gayon, Albay, are not the only active community-based organization. So might as well look for other organizations who have the same initiative that they do in their respective communities and try to harmonize this effort, looking into their current level of capacity and providing necessary technical assistance to also strengthen them to the level of the likes of GM and Gayon. So importantly, along the dimension of public health policy, is to sustain good practices by GM Bicol and sorry, institutionalization of membership of active CVOs in existing HIV and healthcare service delivery network. In addition, for LGUs to enact support policies to the delivery of HIV programs. It's also notable that few months after the conduct of this study, we also got a lot of update as well. Like GMB called scaled up HIV screening despite the pandemic. Also did a lot of of counseling. GMB called partnered with a lot of LGUs, not just Daraga, and even opened our community health center, to provide halfway homes. So like if there are person living with HIV from the southernmost part of the Luzon or from the island provinces no, of Bicol, the GM center provides a halfway home. It means um they can stay there overnight or 2 days, 2 nights, no, so that they have a comfortable place to stay over the night while they try to access their medication to that from the treatment hubs. No, and a lot of initiatives also, like it made sure that refill, no, actually work for people living with HIV, despite of the distance and despite of the geographic uh we know for a fact that like every LGU has their own set of rules to prevent COVID infection. So yeah, it was very much tried to patch up. And community-based organization were also given this frontliner ID coming from the LGU, so that volunteers, especially the volunteer public health workers, can also access borders and checkpoints without due problem there. So that is the end of my presentation, and I appreciate if you have questions or concerns or realizations as well. Siguro we can open the floor for questions or reactions for 3 minutes or 5 minutes. Anybody? If we can use our microphones or the chat box. Thank you so much. The, if I may acknowledge, the president of Gayon, Albay, is here. Sir Rolando Riva. Ay, oh my God. Okay, thank you. Um, just to be sure that we don't have question at this point in time, can everybody please show heart emojis? I can see heart emojis thing here. oh, oh, heart. Okay, thank you, Sir Jason. So that's for the first topic this afternoon. Now, from a sharer, I will shift now myself to a moderator. That's fun part of being a volunteer. Yeah, this webinar is powered by volunteerism. So yeah, as a sharer, I will now shift to my volunteer hat as a moderator. So the second topic is something that I also am very interested in of learning, because it's basically an experience that is really grounded on experiences from working on the ground. Um, if I may request, is Binibining Rufa already? Can you please open up your camera just to make sure that we are ready? Not yet. Binibining Rufa. Oh, there you are. Okay. So Binibining Rufa, can you change your name? Baka the people will get confused.
I-off ko na lang yung sa akin kasi hindi ko magamit yung phone ko, nahulog sa...
OMG, nahulog saan?
Tanggalin ko na lang yung sa akin. Wala, sira ang camera niya.
Okay. So ayan, na-change ko ng name mo. So it's done na. Are you ready na po ba, ma'am?
Baby, ako sa'yo niya. Oy, Rufa, tawag ka.
Okay, okay. So if I understand this correctly, Sir Freddy Boral will go first, then you will go last. Okay. Sir Freddy, if I may know if you're ready, can you please open your camera? Ayan, okay. So you're ready. Thank you so much. So there is a bit change in the program. The last topic will be given second. So at this point in time, I am pleased to introduce the second speaker. He is a public health worker which focuses most of his career as a policy nurse. A policy nurse is not really popular these days, but it's actually a very important role in advancing healthy public policies. Um, he is a member of the board of trustees of GMB Call for Sexual and Reproductive Health, and in this advocacy for more than a decade, he is a personal friend and colleague, a kapatid in advocacy. We've been in the streets, no, really advancing the discourse about adolescent reproductive health, HIV, and family planning for the last 10 years. And it's my pleasure and honor to introduce to him. He is a registered nurse, also a registered midwife, um, well versed on social and health issues. And I would also say that he has a good grasp of what is development and happiness in the context of rights. He works with the Sanggunian Panlalawigan of the provincial local government of Albay, Mr. Freddy Boral, to share with us this afternoon responsive and sensitive, ensuring access to HIV services by young key population during COVID pandemic. Sir Freddy, I will now give you access to screen sharing. And if you're ready, please take away the virtual stage. Thank you. And please give Sir Freddy a round of applause using any emojis that you can think of.
So good afternoon to everyone. Medyo I was drawn by the emphasis given by Sir Kebs on the number of years we have spent with the advocacy. So thank you very much for this opportunity. Well, as I've said, yun nga, the emphasis gives me a feel na mas tumatanda na tayo, Kebs. So, yun. I am designated to give a talk entitled Responsive and Sensitive, Ensuring Access to HIV Services. But I have a little revision a while ago. Instead of young key population, I have changed it to key affected population during the COVID-19 pandemic. So I hope you would forgive me for that. Yun. Before anything else, let me share some considerations. First, this presentation is based on the experiences on the ground. So this is not yet subjected to the rigors of scientific inquiry and process. I, however, believe that these experiences and the accompanying implications also deserve our attention. Number two, perception and interpretation of the people interacting with the clients. So I just want to mention this philosophical view about realities. Sabi nga, may dalawa daw na klase ng reality. I would mention yung phenomenon na pag nahuhulog daw ang dahon sa gitna ng forest. Itong reality bang ito ay based sa kakayahan ng isang tao na i-perceive yung phenomenon na iyon, or realities can actually happen even without yung perception and interpretation ng isang tao. So other experiences may not be captured. It's admittedly one of the limitation of this presentation. And nga, we have different brands of reality. Third would be with the concept of an evolving context. This presentation is not finished. We are in a period when changes are so erratic, hence context, perception and interpretation, and reaction also changes. A bit of a context of my presentation. So part of the title is access. So we unlock key terms. First is access. According to Merriam-Webster, it's the freedom or ability to obtain or to make use of something. So in the context of this presentation and in the context of the work that the organization does, it pertains to HIV and AIDS services. So it's either commodity or services that our clients avail from the organization. So when we talk about AIDS, HIV and AIDS services, this refers to preventive and care and treatment services. So when we say key affected population, these are individuals or people who, for some reason or another, are more vulnerable to HIV infection. Leading literature lists gay and other men who have sex with men, transgender women, female, male, and transgender sex workers, people who inject drugs, and or PWID, and persons deprived of liberty, or prisoners. So the context of AIDS and HIV services is depicted in the slide. So as I've said, it involves preventive measures and itong care and treatment services. So yung first part, yung first 3 columns, makikita ninyo dyan yung identify key population, number 1. Number 2 is to reach key population. And then after reaching them, and after a certain amount of time to convince or to convince them to have themselves tested or screened, ito na yung iti-test or isi-screen na sila. So that's the preventive side of the continuum. So this involves continuous re-engagement with HIV negative key populations on regular HIV testing and combination prevention, including access to condoms, lubricants, needle and syringe, or this is what we call the harm reduction measures, and yung prophylaxis, yung PrEP. And then we go further to the care and treatment services. So this involves, so after ma-identify or ma-screen namin na reactive ang client, we will ensure or we will proceed to the care and treatment part of the continuum. So dito, diagnose PLHIV, and then i-enroll sa treatment, i-initiate ang antiretroviral therapy. Then pag inumpisahan, dapat i-sustain para masuppress ang viral load. So this is to ensure that the client would reach the undetectable status. So yun. So pag undetectable, it means that it is untransmissible. So the continuum will definitely take into consideration human rights and laws, and the treatment should take into consideration zero tolerance for violence. So everything as you see on the bottom part of the continuum, community mobilization and engagement is necessary. So that is the context of HIV and AIDS services. So this is also the workflow for community-based HIV screening. So this can be a source of issues. This can be source of issues to be clarified, and this can be the services that I have mentioned, and then this flow can actually be subjected to some adjustments, especially on the initial steps of the workflow. This is in relation to the adjustment related to pandemic, and yun. So moving on, another aspect of the context of this presentation is the pandemic. So pandemic is defined as a global epidemic, and it spreads to more than one continent. So the primary concern with the pandemic is the impact of the restrictions to our lives, and most especially to the focus of our organization, our clients, the PLHIVs, and yung mga client or key populations na tinatawag. So napakaganda ng presentation ni Sir Kebs. He really gave a comprehensive look of the situation, the HIV situation in Bicol region during the pandemic, or within the pandemic kasi hindi pa naman tapos. So ang gusto ko lang i-establish dito sa abstract ni Sir Kebs is the effects of COVID-19 related restrictions does not distinguish kung sino lang ang pipiliin niyang maapektuhan. Lahat tayo apektado. So for PLHIVs, this means that services, life-saving services can actually be inaccessible for them. So yun. So nakikita din dito na affected yung pag-access nila sa medication, sa antiretroviral drugs, and then some was laid off, and wala na silang source of income, na lockdown in several locations. Tapos na-emphasize din na yung need for functional treatment hubs in Bicol region. So yun. Another aspect of the context of this presentation is responsiveness and sensitivity. So when we say responsiveness, it means reacting quickly and positively. So the lower statement says a flexible service that is responsive to changing and economic patterns. So this means that in the context of the organization, we have to adapt. We have to be flexible to be responsive. We have to address the current needs of times. When we say sensitivity naman, having or showing awareness and understanding, especially of other people's feelings and needs. So yun. Sa context naman ng pandemic, it is important that we look into the human rights component of service provision. It says here, so when we talk about human rights, it's the relationship between the duty bearers and the right holders. The duty bearers has the obligation to respect, promote, and protect human rights. And lastly, fulfill human rights. So when we say fulfill, it has something to do with the adoption of appropriate measures towards full realization of the right by enacting laws, policies, institutions, procedures, and resources to enable people to enjoy their lives. On the part of the rights holder, kailangan, or according to the source that I've got, rights holders have the responsibility to know, exercise, claim, and defend human rights. So in this context, pwede ba nating i-claim na the deprivations, the restrictions na nabigyan ng ilaw or that was highlighted ay isang form ng human rights violation? So I'm just leaving that question for everyone to answer. So, yun. So we come now to the responsive part of my presentation. This is the GM experience. So I'll be tackling the issues one by one, or the adjustments that we have done. So yun. First would be screening by appointment. So since bawal na ang mass gathering, and also to protect our CBS motivators, kailangan hindi crowded ang aming facility. And you can locate our facility in Daraga Albay. So yun, we do screening by appointment in compliance with the requirements of government. Another is to protect our client, our CBS motivators. And likewise, it addresses the privacy and confidentiality concern of our clients or the key population that we handle. So makikita nyo na nakaturo siya dito sa first three columns sa preventive aspect ng HIV services continuum. Okay. Medyo nag-lag lang yung laptop ko. So we come now to the second adjustment. We do facility-based screening and at the preferred place, or we do screening at the preferred place of the client. This is to ensure that the confidentiality and anonymity concern, the privacy of the client is still maintained. So that's another form of adjustment that we have done. Individual health education. So dito nakaturo siya dito sa rich key population. Before, knowing that the Philippines has the fastest transmission for HIV in the Asia and the Pacific, ang approach noon ay mass information dissemination. But because hindi allowed ang mass gathering, we took advantage of the time na mag-encounter kami with our clients, and we do comprehensive discussion about HIV, STIs, and some of the concerns or some of the facets of HIV care in the Philippines. Likewise, in the platforms that we use, saan ba? Example, Grindr, Twitter, Facebook, to name a few. We sometimes discuss that kahit na medyo mahirap mag-type, yun, we do alternative ways to impart knowledge. So reaching out to our target clients is through social media. So yun, we use Grindr, we use Facebook, we use Twitter, we use Instagram. Practically, we are present in those social media applications. So flexible screening hours. So dito na nakaturo siya dito sa test key population. So it means na how do we express this? Hindi fixed na 8 to 5 lang ang aming ano yon, ang aming excuse me, somebody is calling. Wait lang. Okay, so when I say flexible screening hours, hindi 8 to 5 lang. We adjust to the needs of the client. Minsan, we stay in the office after 5. I had a client na pumunta dito ng alas 8 ng gabi at dahil marami siyang questions, inabot din kami ng 10 p.m. So kahit na ano yun, may ang tawag ng curfew. So dahil doon wala akong nasakyan, naglakad ako. Naglakad. Anyways, but just to concretize what I mean by flexible screening hours. So even on Saturdays, on weekends, we screen depending on the appointment ng or agreement ng CBS and then ng client. We also do barangay visitation, pero hindi naman siya yung kasi parang it provides the IATF naman provides ng minimal na participants. So there was a time na 50% ng capacity ng isang venue ay parang allowed. So we do barangay visitation. So we also participate in clan activities. So for those who are not aware of this, may mga grupo-grupo na yaon sa nandiyan sa social media and na-penetrate din namin yon para just to be with the key affected populations. We also do collaboration with stakeholders, NGOs catering to other key affected populations. So yesterday we just had a collab activity sa Barangay Buraguis dito sa Legazpi City. So napakagaling ng kanilang barangay captain at ang council and SK. So I appreciate the effort of these people to work on a very vital matter. And just recently, we also had a collab activity with an NGO in Catanduanes. So yung NGO na yon ay tinutulungan nila yung mga person who uses drugs or those who are recovering from drug use. And lastly, preferred CBS motivator. May mga times kasi naman na ano yun, may clients who prefer female CBS motivator. So we have female motivators who do the screening. And likewise, there are also clients who prefer members of the LGBT who to do the screening for them. And isang issue dito minsan kasi pag yung client ay kilala yung CBS motivator. So we ask the client kung comfortable ba siya na magpa-screen sa kakilala niya na motivator, or we can get another one, or we can coordinate with another CBS motivator to do the screening. So yun. Okay, so that's the itong last portion hindi ko pa na-edit. So this goes to the sensitivity portion of the HIV services provided by GM Recall. So yun. So these are practically efforts to be responsive sa panahon ng pandemic. So highlights. So adjusting to the preference of the client. So I would call this kami or tayo na ang mag-adjust approach. So yun. Number 2, immersing in places, platforms, and venues where key affected population can be found. Third would be screening is voluntary. We maintain that. We uphold that. Confidentiality and anonymity is observed. So though there are various applications depending on the agreement of the CBS motivators and the client. So an example of this is confidentiality and anonymity. There was one time when I actually screened sa Bicol University. I think I have, I see one professor from Bicol University College of Nursing, si Ma'am Roan. Shout out Ma'am Roan. But I have screened one client. Hi Ma'am Roan. So I have screened one client sa field mismo ng Bicol University. Wala namang tao doon, and I hope the wide expanse of green meadow actually protected the identity of the client. So this is my interpretation of this statement, that application of the concept of confidentiality and anonymity can vary. Yun. And next would be approach is also dependent on the strength and circle of influence and reach of the CBS motivators. Well, I understand. I think this circle of influence and reach should be taken advantage of. Example, ako, I immerse myself in the application, and yun, these are the clients that I encounter, that I screen, that I serve. While we have another volunteer member of the organization na yung circle of friends naman niya, ay napakagaling niya mag-organize ng mga events for particular clans. So yun din ang kanyang circle of influence and reach. And I believe si Binibining Rufa is actually doing what they call this, barangay visitation. I admire the passion of this woman, really. So yun, we should take advantage of our circle of influence and the reach and the God-given talents that we have. Next would be, I would highlight the transition from mass-based health education to individual level of health education or information dissemination. So I indicated here yung no stone left unturned. So whenever I do the screening, so maybe people will be discouraged, but I really spend time with my client at like for 30 to 45 minutes to ensure that there are no stones left unturned. But I have noticed also a limitation. Through the HIV/AIDS services, should I say, though HIV and AIDS services are open to all, and it should be accessible to all, funders' predetermined deliverables affected yung ano yun. So merong ano yun, may effect din yun. Kasi we operate on the funding that we receive, that these funders grant to NGOs and CBOs like the gentleman before. But we noted clients that are women, pregnant women, pregnant women, and then yung kasi ang focus kasi is yung key affected population. So yun. So we now come to the sensitivity in the provision of HIV and AIDS services. Again, it's the experience of the volunteers that we gather, and hopefully I'm giving justice this afternoon. So again, I'll be enumerating and discussing them one by one. Yun. So confidentiality and anonymity. So it still remains a hotly contested issue within the organization because some different folks, different strokes, so we have different interpretation then, and we brainstorm, we try to talk, we have a dialogue to clarify things related to these concepts that are vital to the human rights approach of HIV and AIDS service provision. So yun. Kasi may mga times kasi na just to give an example, I was invited to share about the experiences of my clients, the people that I have helped and served. But I was really hesitant to share the data because as we define confidentiality, this refers to the protection of the information that we gathered. So what I did was like to tweak and the information para hindi maging ano yun, direct or indirect na. Yeah. And definitely we ano yun, we maintain pag-refer sa the ano yun, we maintain the secrecy of the identity of our clients. Next would be subjectivity of clients' level of satisfaction. Though we have though we receive like compliments and expression of gratitude from our clients, we also have bashers. So hindi naman kami perfecto, and iba yung pagtingin ng ibang tao sa serbisyo na binibigay namin. So we recognize the subjectivity of the level of satisfaction ng aming mga kliyente. Likewise, we also encounter clients who would insist on giving us money. Well, personally, I do not receive because I would say that it defeats the purpose because we advertise that our services are free. So this can be so receiving any amount would result to some issues. So yun. But there's also clients who express their satisfaction through like example, we were invited for a dinner. I think acceptable yon. So I granted the invitation of that client. Well, we have different concept of right and wrong, but if you have a different perspective on that, you may also share it later on, perhaps, if we have time. And then second would be balancing the interest of one client with another client. So we encounter clients na nagpa-schedule ng 1 o'clock and then nalilate. So we have to balance, we have to recognize that there may be clients na naka-schedule din sa susunod na time. So yun, may iba na basta na lang nag-appear sa aming facility. So that would affect the yung request ng aming client na for privacy and anonymity. But we tried our best to ensure, because the office is quite huge and we have a number of rooms then, and that's why we can do separate screening, and then while ensuring that the information is not known to others. Ilinagay ko itong trust and honesty. Dito, nakaturo siya dito sa rich key population portion. Because, or pwede din siya dito sa HIV or sa testing client or key population. I would underscore the word trust because it is a challenge for CBS motivators to really convince client. Because we talk about stigmatization, we talk about embarrassment. So we don't know the circumstances of these people. So we have to ensure that our clients can trust us and all. Linagay ko din siya dito yung word na honesty because I think this can be a source of issue probably in the future, though we haven't really encountered an actual case. But I would say that we have noted clients who are actually not truthful to us. And this affects our, this affects the context of our suggestions, like health educations and everything. So, ang kinakatakot ko lang dito, siguro I'm the person na kadakon or maraming anxiety sa life. So iniisip ko, I overthink na probably in the future, we encounter a client that would blame us because of an unfortunate thing that would happen, that would possibly happen to him. But I would underscore the importance of the CBS form. So there, the parts of the CBS form is yung basic information about the client, and then very vital doon yung HIV assessment part, because that would say na ano yun, or that would indicate yung kanyang sexual behavior and all. And an important feature of that form is the part that would require, or that would require the signature of the client. So I would say that possibly there would be some legal implication, but I would underscore the importance of CBS forms as we deal with our clients. So yun nga, we adjust our time, our resources, our facility as a way to respect preference. Yun. Mental health of clients. So kailangan din natin tingnan ang mental health mental health status ng clients, because I've heard sa Manila there are like actually suicidal clients na nakikater ang ibang NGO sa Manila. And I think we have one, kailan ba yun? March siguro yun, or May. Tapos though we are determined to help the person, but kahit anong support na gagawin namin, you would see the client na parang hindi na niya na-absorb yung yung sinasabi namin, yung support na supposed to be intended na support siya. Next would be clients taking picture of the test result. So I have a different view here, and siguro some people would share the idea with me. The clients who wants to take picture of the test results. Actually, I do not allow. The reason why is this: number one, we cannot control kung ano ang gagawin niya sa picture na yon. So, and out of sensitivity din sa mga PLHIV, na client namin or out there, baka yun yung hinihintay na trigger. So baka may mental health issue, so pwede yon. And we also noted a client na after niyang magpa-test or magpa-screen, ipinost niya doon sa kanyang social media platform. And this is to invite people or to encourage people to try him. I mean, in the sexual way. So yun. But other people would say that this could be a form of discrimination because what if mga mayayaman, ano yun, can actually do that. But I have my reasons. And I hope hindi naman siguro yun big deal. Next would be reinforcement of stigma. So nakuha ko ito kahapon when we had a talk, when we brainstormed doon sa Buragris with Mr. Jer Evan and Ms. Kat Bailon, na baka ngaya, example, measures like adjusting ngayon na ano yun, your how shall I put this, yung preferred na example, yung preferred na tao na magsi-screen sa kanya, like binigay sa akin ni Jer na yung idea na this could be reinforcing the stigma. And siguro dapat ngayon maging comfortable daw siya doon niya sa friend niya and all. But I think the respect for preference would still suffice because siya yung involved doon. Yun. Next would be care of CBS motivators. I would emphasize that encounters should not focus only on clients, but we should also take care of our CBS motivators because of the things that we absorb, the things that we have noted, cases of abuse. We have noted ano pa ba? Yung client na nag-suicide. We have encountered different life circumstances, and it's kind of stressful. Medyo mabigat din siyang dalhin. Even yung clients that we screen, clients that yung mga nagre-reactive, we think of them. We sincerely think of them. Kasi may mga times na hindi na sila nagpaparamdam. So it's taking a toll on the part of the CBS motivators. So we have to take care of the CBS motivators. Sa reaching key population, we also experience indecent proposals directed to CBS motivators. We all know that we maintain our presence in the social media platforms, and they would perceive that as being open to the idea of relating in a sexual way. So yun. So this may, should I say, we are putting ourselves in the front line, but we are also subject to this kind of phenomenon that would be harmful to our well-being as CBS motivators. And lastly, yung safety. Diba, we do adjustments like in terms of time, in terms of place, but we are actually running the risk of like meeting very violent people or people na may masamang balak. So we have to take care of them. Well, individually, we make sure that make sure na hindi kami magiging victims of this kind of safety safety concerns. And lastly, termination of CBS motivator-client relationship. For nurses and for nursing students or for healthcare professionals here, I think this also applies to any professional na may interaction sa ibang tao or service provider and client relationship. So I emphasize this because may ibang client na hindi, so probably ibang client and probably CBS motivator who may not have the concrete idea or hindi klarado yung boundary, hindi klarado kung kailan nagtapos, kung kailan dapat nagtapos ang CBS motivator at client relationship. So personally, I have a client who constantly asked for load, for load. Pang ano daw niya pag anong tawag niyan? Online class. Well, they have to understand the limitation of our organization, and it's pandemic also, and then we volunteer our services, and then the clients are actually trying to take advantage of that. So that I would emphasize to CBS motivators and for nurses and nursing students who would eventually engage into this kind of encounters or engagements to ensure that the relationship is properly terminated, and the services that you offer should be well established to the clients para maiwasan ang mga ganitong mga pangyayari. So highlights. One, we should also look into the welfare of the CBS motivator. How far can we accommodate client preference over the welfare of the CBS motivators, and vice versa in areas of mental health and safety, and etc. So encounters with client are not solely about them. So may CBS motivator din tayo na dapat na kinukonsider. Number two, termination of CBS motivator client interaction. And I would add clarification, clarifying the services para hindi naman kayo masubject sa mga unnecessary requests ng mga client. And this is also to protect you from extremely or exploited by the clients. And number four, how far can measures in the name of responsiveness go when it produces the unintended outcome? But in gender and development, there is such a thing as temporary special measure. So kahit na it would lead to discrimination or what, pero this is in the name ngaya of service, in the name of responsiveness to our client, then it is acceptable, somewhat acceptable. And lastly, there is no single appropriate approach to clients' experiences and situations. So individual differences of CBS motivators and client per se. Different folks, different strokes. So this refers to the approach of CBS motivators to client, especially on aspects of care. Maybe I'm on my last several slides. I would say that may this sharing open our eyes to realities of people. And probably the things that I have shared would spark curiosity and dialogue. That way, we are both enriched. So I would like to acknowledge, I would like to recognize the people who helped me in developing this presentation. One would be the stories and experiences of clients that enriched our lives. Number two, the countless moments of brainstorming with officers and members of the Gentleman Recall, and to Sir Kebs for the guidance and concrete assistance, especially dito sa yung abstract na ibinigay mo sa akin. And then, and I presume you permitted me to, to share it. I would also give credit to Jer and Kat for giving form when I am lost, blinded, and out of my mind. And to God Almighty, the source of love, knowledge, and compassion. And let us converge our efforts. Let us converge our talents and efforts to end the HIV pandemic. And for my last slide, thank you very much. Thank you very much. And
Thank you so
I think,
much.
yeah, thank you, Sir Kebs. So
Thank you po.
at this time, thank you so much. At this point ba, Kebs, are we entertaining questions?
Yeah, yes, let's open the floor for questions or reactions or anything that they may want to share, reflection or something. Anybody who have something to say, you can open your mic, or if you are not comfortable of sharing your thoughts, you can also use the chat system. Send private message to Sir Freddy or to me, or send it to everyone. Ayan. So anybody po? So while we wait for people to send their question, first I'd like to share my thoughts about how admirable Sir Freddy is, especially in sharing his personal experience, no, working on the ground and really meeting a lot of clients, and oftentimes these are experiences that needs also to be discussed, and if possible it should also be written so that people can also read about these stories, because yeah, sinabi mo nga kanina na those are experiences from the ground and may not yet be subject to empirical lens, but then again such experiences are part of evolving knowledge. And I would also like to point out that even our existing theories right now along the lines of development and even along the lines of health, 'di ba? We parang most academics would refer to theories and models. It's a product of both thinkers and doers, and I would assume, and I truly believe that knowledge and theories and those conceptual models are not limited to the higher institutions, to the academic people, to the intelligent people, but it is shared knowledge by both the thinkers and doers. And for doers like our frontliners, no, those experiences can actually really improve how we bring services to the level where people can access it, no, without any prejudice, without any biases. And I think it's a really good sharing, Sir Freddy. Thank you so much. Oh, I can see here there is one question posted. It was sent to me privately. Sir Freddy, the question is, how do you handle stress kapag kinakausap ang client? Like, not all the times po is okay tayo mentally. So paano natin i-handle po yung stress in doing the work?
Well, I really would papatunayan, isang malaking pagpapatunay na napakahirap talaga na kumausap ng mga kliyente. As I've said a while ago, I encountered like clients na naka-experience ng abuse, naka-experience yung suicidal clients. We invest our emotions. We invest our emotions, because these things are things that we feel strongly about. How do I handle stress? this is my personal, kumbaga, ano yung tawag niyan, coping. I sleep. And then I sometimes distance myself for a short while para makahinga-hinga ako ng kaunti. Because yun nga, as you've said, hindi tayo always okay. Yun. So yun, as I sleep, sorry to say, pero nag-stress eating din ako. Pero that's not a good way to cope because it would also be detrimental to my health. But recently I have discovered exercising, how happy it is to go to the gym and just focus on the exercise and not thinking about the clients, the services that we provide. And I also love biking. If you have time to detach yourself from distresses, you can climb a mountain. Yun, I do that. Yun. So that's my personal coping from the stresses that I experience with the services that the organization provides.
Thank you, Sir Freddy. Ayan. Actually, that's why we work with teams, no? That's why we work with groups. Because if you cannot handle it alone, then you call for a friend. Di ba? Parang ang ganda nung pagkalatag mo dun sa acknowledgement na thank you, Kat and Jer, for, sa pagsasalo every time I fall. No? So I think it's a valuable lesson also I learned personally from your presentation that it's really nice if you are part of a group, of a team, diba? So that if you can handle it on your own, there are those friends who are also ready to have your back anytime. Ayan. So thank you so much for the question we got. No? So at this point, Sir Freddy, wag ka muna alis sa camera. Let's ask for Binibining Rufa to show up, please, for the last session this afternoon. Binibining Rufa. Oo, feeling ko tumatakbo na po siya papunta sa kanyang gadget. Ayan, hello Binibining Rufa. So to introduce the next speaker to share, I met this wonderful lady who later became my friend way back, fighting for reproductive health law that she really showed effort to uphold. And Binibining Rufa is a staunch advocate of human rights, diversity, sexual and reproductive health and rights, LGBTQ rights, and SOGI. And I would like to express also that apart from becoming a nursing graduate, soon to be taking her board, good luck. She has been in the line of public health work, no? Since I can remember. And for her presentation, she will be sharing with us their experiences as a community organization, especially on the aspect of really creating actions and working towards making a more inclusive society to promote accountability and let's say actions that is really coming from the level of the community. So ayan, Sir Pe, thank you for sharing your thoughts on the practice on the ground. So now let's hear from somebody who had first-hand experiences in working as an organization along the lines of advocacy and networking. So Binibining Rufa, please take the stage.
Hello, Kebs. Hello.
Yes,
Hello,
we can hear you.
everyone. Naririnig ba?
Yep.
Hello. Hindi ko marinig yung sarili ko.
We can hear you. We can hear you.
Hi. Wala.
Loud
Narinig
and
ako,
clear,
Kebs?
Ms. Rufa.
Yes, we can hear you. We can hear you.
Yan, ayan. Naano naman ako sa introduction mo, nakakaano, parang it makes me realize na I'm already on my 30s. Ayan. So, thank you, Caps, and thank you, Sir Freddy. Yung mga presentation nyo, marami naman akong natutunan. Kaya gusto ko talagang ang sumasama sa inyo. And dahil nagpasalamat na kayo kanina, pasalamat ako din yung mga nakasama ko along my way doon sa ating mga advocacy
Kunin mo yung ano
works.
mo.
Like sina
Kunin mo yung-
Kevin, si
Kunin
Sir Kevin, Sir Freddy Burao,
Yung-
sina Toots, Gayon,
yung ano,
headset. May headset.
ano sa
Kunin ko yung headset ko, Bea.
yung maraming manok.
Marami kasing manok, sorry. Marami kasing manok, Kev, sorry. Ayan, naririnig ako? Naririnig?
Yes, please. Oo.
Ayan, thank you talaga. Well, yung presentation ko ngayon is all about yung personal experience ng Gayon Incorporated, yung organization namin, na nakasama din ng Gentleman at ng Gentleman Bicol and nila Kevs and nila Sir Freddy. So, yung Gayon ay isang LGBT organization na nag-start po siya na nag-focus muna kami main on the LGBT community, tapos later part ang nalaman namin na parang kailangan din namin na i-include sa aming mga project and programs ang general public. So ito rin yung reason, Kuya Kebs, kung bakit I decided to take or to study again na mag-aral ng nursing para din may apply ko na siya in the near future. Kasi marami kaming naging experiences at nakatrabaho on sa mga health facilities at alam namin na there is something ano lang talaga missing or may missing link doon sa pagbibigay nila ng care and services para sa mga marginalized sector like the LGBT communities sa ating mga young key population. So sabi ko, ay, mag-aral ako ng nursing para if ever at ako'y makapagtrabaho sa isang public facilities, eto yung ideal na pwede kong ibigay na services for them. So simulan na natin, Kebs. Ayan, yung gayon po, ang minimithi naming mangyari ay ma-strengthen po yung Bicol LGBT Regional and CBO Network. Magkaroon din po ng strong and organized LGBT community-based organization at ma-encourage po lahat ng CBO na magpa-register sa mga national accreditation bodies like SEC, BIR, and sa mga government agencies, DSW, DDOH, and maging member din po ng mga local special bodies like the local AIDS Council, LHB, MDC, and etc. Which is, yung gayon naman ay naging successful naman doon na kami ay makasama at maging member ng mga special local bodies. Next po, Ben. Ayan. Kaya namin in-encourage po yung mga CBOs na magpa-accredit, mabuo sila as an organization dahil lahat ng naging organization though meron na silang mga existing groups, marami ng organization na naririnig namin na nagtatrabaho din on same cost like for SOGI and HIV. Kaya lang, nabubuhay lang sila during mga fiesta. So, we encourage them na dapat the year round, ganun yung gagawin nila. So as of now, ang Legazpi City po ay meron po kaming mga na-organize ng 12 community-based organization sa 12 na barangays. Meron din po sa Masbate, dahil malayo, doon nga sa presentation ni Kebs na kailang very unique ang geographical setting ng ng Bicol region. You have to travel by land, air, and seas. Charot. Meron lang kaming 2 municipalities. So, meron din po kaming isang community-based organization sa The Rice Granary of Albay sa Libon. Meron din kami sa Camarines Sur, 3 municipality din po yun. At yung pinakamalayo ay yung Catanduanes, yung municipality, isang municipality lang po. Pasensya na ba na out? Ayan. So yung sorry po. Narinig pa ako, Kebs? So ayan, yung network of LGBT organization in Bicol region, meron din kami mechanism where the community-based organization can discuss issues and concerns on the community including mga project and activities. So we make sure na kailangang napag-uusapan siya, napagpaplanuhan, ang dami-daming brainstorming kasi gusto namin na pulido yung magiging activity namin on the ground level. And also, we want to push the LGBT advocacy sa HIV and AIDS prevention and awareness. Ayaw namin mag-focus lang sila on beauty pageants, ML, ano pa yung mga activity ngayon, beautification ng barangay. We want them to focus on the HIV and AIDS awareness and prevention. And sinasabay na din po namin yung sexual orientation, gender identity, and expressions. And of course, yung equality sa bill and human rights. Next po, Kev. And of course, yung formation po ng new members and strengthening of the existing LGBT organization sa 6 pong probinsya ng Bicol Region. So, bali, pag pumupunta kami doon sa mga provinces na alam na namin may mga existing organization na, we want them to keep their own identity, pero we want them also to incorporate yung project namin yung sa HIV, SOGI, and human rights. And of course, yung makapacitate namin yung mga organization sa level ng ang HIV, AIDS, SOGI, human rights, and of course sa governance. Kasi encourage the community, like sa LGBT community, we encourage them na mag-participate sa mga local special bodies, and at the same time, we encourage them to run for local election like sa barangay level na may mga naging successful naman kami mga naging friend na tumakbo ng barangay councilor and barangay captains, meron din municipal councilor para naman sila yung nagiging champion namin. Oo, doon sa aming mga activities. Like for example, sa Masbate, meron kaming vice mayor and meron kaming municipal councilor. Yung pagdadala namin ng aming programs on the prevention and awareness of STI, HIV, and AIDS ay madali na. And of course, sa susuportahan ng ng local government unit, yung existing community-based organization. Next po. Ayan, so as of now, marami na po, nasa list na po. So, yan pong mga community-based organization po, ay yan po yung mga nadalaw, napuntahan, naturuan, at na-trade ng gayon LGBT organization sa Bicol Region. So as of now, yan po yung aming, ito during mga months before the total lockdown. Oo. So medyo marami pa yung nagagawa namin. Next po. And other LGBT orgs. So meron din kami mga empowerment activities and programs like capacity building activities and training. So meron kami mga organizational development, especially on financial management, yung HIV 101, yung SOGI, human rights, and of course yung ating mental health na very ano siya ngayon, very timely dahil nasa pandemic tayo. And of course, dahil po yung Bicol region ay madalas po madaanan ng bagyo, we have also the Mayon volcano na pumuputok din po minsan-minsan. Ini-incorporate din po namin yung disaster risk reduction and management. Next po. Next po. So, hayan. So paano namin nasusustain yung aming LGBT community and yung aming partnership with the community level? We work with the national and international LGBT partners and policy advocates. We also work with the Department of Health, Commission on Human Rights and sa ating mga local government units para din ma-encourage, para din magkaroon ng access ang mga CBOs on funds. Oo. Mga active members then ma-implement yung LGBT sensitive and proactive projects. Kasi minsan especially doon sa God budget, we really encourage the community-based organization na bantayan nila kung saan at kung paano ginagastos yung pondo, kung akma ba doon sa pangangailangan nila yung mga nagiging proyekto ng God. Kasi minsan yung sa God project ay minsan nauuwi siya sa mga walang kabuluhang proyekto like welcome rotonda ng barangay. Then yun po. Next, Bebs. Ayan. So yung gayon, before the pandemic, Bebs, yung gayon ay na-involved din sa aming health teaching. We consider this as health teaching, Kuya Kebs, kasi dinadalaw namin yung mga senior high schools sa province ng Albay and as well as sa province ng Masbate. So ang dami na naming napuntahang mga senior high school and junior high. So tinatawag namin siyang ang Responsible Parenthood and Reproductive Health Education School Caravan. Next po. That was before the pandemic ha. So hayan. So ang dami na po ang 26 junior and senior high school sa Albay. 2,897 students po ang nabigyan namin ng lecture on family planning and reproductive health, adolescents reproductive health, and yung gender-based violence, sexual orientation, gender identity, and expressions. And of course, yung aming pagpo-promote ng RPRH law. Next, be. Ayan. That was ayan. Next po. Next. Ayan. So yung Bicol LGBT Empowerment for Sustainable Communities serves to empower these informal groups to oversee their participation in the local government unit, like taking part in the local development council, like local health board, local AIDS council. So we make sure na kapag may meeting ang local special bodies, especially yung LAC, ay dapat merong representation ang community para alam din ng community kung saan at kung paano ginagamit ang budget at nakakatulong din ang community sa pagbibigay ng mga inputs on how to improve yung ating mga existing programs and policies, especially sa teenage pregnancies, sa adolescents reproductive and sexual health, and sa human rights and gender-based violence. And of course, yung aming mga accreditation sa DSWD, sa DOLE, sa DTI, para din ito yung mga government agencies na to, meron din kasi sila mga allocated budget for gods. So nagagamit din siya sa purpose ng LGBT empowerment, and of course doon sa ating mga young key populations like young people, mga young girls, young boys, young transgender woman, young lesbians, and young gays and bisexuals. Next po. Ayan. Ayan. Ayan yung Kuya Kebs, yun yung mga naging partner ng gayon. Of course, kasama yung Gentleman, Hinanay Grandiosa, Kamalagay News, Uwas Amazing LGBT, Gayon Claveria, Gayon Maylao, Daraga Gays, Rapo-Rapo. Ito, before magka-pandemic, before magkaroon ng local lockdown, March 18, 2020, nung nag-lockdown ang Albay, ang last activity namin ay isang RHPH activity sa senior high school sa bundok, sa Highlands, sa Kamalig. Ito yung way going to Hovilliar. So ito yung last activities namin, and very challenging siya, Kuya Kebs, kasi ito yung araw din na parang ito yung araw na last nang magkakaroon tayo ng physical activity, yung nadadalaw natin yung community. So after March 17, nag-shift ang programa into online. Oo, into online from face to face, naging online na siya. So, meron din kami eto yung mga activities na ginawa ng gayon in partnership with the international and local um, with the local government units. Meron kaming Bicol Regional LGBT meeting and project presentation. So, yung lahat ng mga existing LGBT organization working for STI, HIV, and AIDS, yung mga nag-outreach education program, yung gumagawa ng mga community health teaching, ay binigyan namin sila ng pagkakataon to present their projects, yung kanyang mga project proposals with mga budget proposals din. Tapos titingnan namin kung saan makakatulong yung organization and then yung aming mga partners NGOs. And of course, dahil tinulungan namin silang gumawa ng mga proposals, tinuruan din sila ng governance and financial management training kasi importante yung matuto yung isang organization to manage their finances para din sa sustainability ng kanilang mga programa and then ng kanilang organization. And of course, same with Gentleman, same with other organization, nagkaroon din po ng peer education training on SOGI, HIV AIDS, and human rights. And nagkaroon din kami ng parang immersion. So after nilang i-present yung kanilang mga projects na gusto nilang gawin sa kanilang localities, naghanap kami ng mga communities na welcome yung ganitong konsepto ng outreach education program at doon nila unang ginawa yung kanilang mga plano. Ay naging successful naman so far. And the rest is meron kami mga consultation, yung training of trainers, human rights, and during the lockdown, nag-focus na kami doon sa relief kasi same yung naging problema nila Sir Cotton and then nila Sir Kevin, yung during the pandemic, ang dami nating mga kasamahan na nagkaroon ng problema, especially sa PLHIV community and doon sa mga young key populations na nagkaroon ng problema on accessing um, um, basic health services, especially doon sa HIV and AIDS, awareness and prevention sa mga commodities like condoms and lubricants, sa family planning. So, pinatuloy din namin siya. So, kung nagkaroon kami ng face-to-face, lakas loob yung organization namin during the pandemic, nung kasagsagan ng pandemic na dumalaw. Sayang, gusto sana namin maglagay ng picture, Kuya Kevs, kaya lang, may mga pictures kasi kami na yung mga client ay hindi comfortable na i-share yung kanilang mga pictures. Though mga nakamask naman sila, pero madali kasing makita yung mga mukha nila. So pinupuntahan namin sila sa kanilang mga localities kung nahihirapan silang dumalaw sa mga social hygiene clinic, kung nahihirapan silang... Narinig ba ako? What do you think?
Yes po, yes.
Ayan.
I can hear you.
Okay. Kung nahihirapan silang pumunta sa health centers, sa social hygiene clinic, sa mga hospital dahil may takot yung ating community na bumusita once nagpa-check up, baka i-consider daw na COVID. So ang ginagawa namin is yung ginagawa pala natin, we bring the services right at their doorstep. So kung hindi nila pwede, tayo yung pumupunta sa kanila. So sabi nga ng mga kasamahan natin, nung nasa bundok tayo, paano ba nyo nalalaman na may mga bahay pa sa unahan? So ang joke time natin noon ay habang may kable ka ng kuryenteng nakikita, sundan mo lang yung kable ng kuryente dahil siguradong may bahay sa dulo. Pero ang problema niya, pagdating sa dulo, yung kable, nung isang kable ay biglang maghahati into two. So bahala ka na mamili kung magle-left ka or magle-right ka. Basta siguraduhin mo, pag uwi mo, susundan mo ulit yung kable ng kuryente. So may mga kasamahan tayo na ginagawa ang outreach education, mga 5, mga 3 o'clock kasi wala nang init, maglalakad sila, pupunta nila yung community na nagre-request, may dala silang commodities, and And aside doon sa commodities and services na dinadala natin, sinasama na rin natin kahit nagkakaroon na tayo ng mga muscles sa katawan, kahit hindi naman natin pinangarap maging bodybuilder, nagbubuhat na tayo ng bigas at mga pangmayamang sardinas at corned beef para maibigay din na tulong para doon sa ating mga key populations and mga sisters from the community. Next po, Sir Kebs. Ayan. Thank you, Kebs. Baka may question kayo, Kebs, na hindi ko na-discuss. Oo.
Thank you so much, Binibining Rufa. And that was actually a very good sharing. As we can see, it is very important also that communities are part of decision making, especially that we have to put programs and policies in the context of the people so that its purpose is really clear. Like it's so very interesting also to know na yun nga mga jokes sa community, no, pero yung mga jokes sa community na sundan mo lang yung mga linya ng kuryente, it's actually a translation of how services should follow those lines. Hindi pwedeng nasa sentro at nasa urban areas lamang, 'di ba, ang mga serbisyo, kundi dapat sinusundan din ang kasuluk-sulukan ng mga komunidad. Thank you so much, Binibining Rufa, for that wonderful sharing. Now let's open the floor again for questions if there are any. Ayan, Binibining Rufa, may question dito.
Yes po.
It was sent directly to me. May I ask kung ano na po ang current situation regarding SOGI bill? Like, is it approved na po ba or close to being approved?
Hindi pa approve.
As of now, Kuya Kebs, yung SOGI bill ay hindi pa po approve. Oo.
Nasa committee yung SOGI.
Nasa committee yung
SOGI
SOGI.
quality.
Actually, very unfortunate that most of the people in both houses of Congress are not yet that very supportive of SOGI. In fact, no, if you follow the news,
Gusto nila ipasa.
there is a certain senator na sabi niya, I am married, I have kids, this is that, this is what I do. Do you think I have SOGI? May impact ba sa akin ang SOGI bill na yan? Well, nakakatawa yung tanong na yun kasi
True.
if, 'di ba, if we listen kung ano yung SOGI,
Kasi Kuya Kebs, ang gusto kasing ipasa ngayon is yung sa basis ng religion and ethnicity, race. Pero yung on the basis of sexual orientation, gender identity and expression, parang wala talaga. Parang hindi maihabol siya. So yun yung nangyayari ngayon. Pero hindi pa rin kami nawawalan ng pag-asa na hopefully baka in the next Congress during this election. Kaya mahalaga din na mag-build din ang community ng mga champions na mapalitan na yung mga wala namang gawa.
actually,
If I may butt in,
yes,
Sure.
Sir Ped.
this is just a quotation. It's election time, and may nabasa ako na the people you elect is the government that you deserve. So people should think about it.
Magandang linya yun, Sir Freddy. And if I may also add, part of community participation is really choosing your leader. So
Yes.
if you want to be part of the solution, then try to vote wisely and really vote for those people who bring also your issue. So kung magsasaka ka, iwasan mo yung mga hater ng magsasaka, 'di ba? Parang ang daming ganyan sa Senado. Kung nasa transport group ka, tapos medyo ang tsaka ng may plate number sa harapan, edi iwasan mo yung mga promotor ng ganong ideas, no? So I think your participation would also reflect on how you exercise your rights to suffrage. So,
Kuya Kebs,
yes
nakita
po.
ko kasi Kuya Kebs sa screen, parang ang daming mga young people, mga young beautiful people. May I grab the opportunity na kausapin sila na please register. Charot na. Oo,
And last week na to register, ha?
Oo. And so far naman, nung nakikita ko sa Comelec, dito sa Legazpi, ang dami talagang mga young people ang nagtitiis pumila sa init. As early as 4 a.m., andun na sila sa Comelec. So parang there's still hope parang nakikita ko pa rin na may pag-asa kasi kung baka sawa na din yung mga batang 'to sa existing government na meron tayo kaya gusto nilang bumoto at sana gano'n yung iniisip nila sa iniisip ko. So dito sa mga participants, Kuya Kebs, sana please registered and please vote. Oo, sa susunod na
True.
election.
Yes. Anyway, there's another question here. For I think this is for you, Binibining Rufa. Binibining Rufa, by the way, to the audience, Binibining Rufa is also a frontline worker. He serves in a public district hospital in Albay. I think this question is for you. Ano po ang ginagawa nila sa pasyente na di makapunta sa ospital dahil baka akalain nila na may COVID siya kahit ang kaso lang or hika? Or sometimes anomaly na related kunwari sa pregnancy. So paano daw sinosolve yung mga ganong klaseng anxiety ng patients?
Ayan, of course, balik kami doon kasi yung Pilipino ay meron tayong poor health seeking behavior at hindi natin yan maitatanggi. Hangga't kaya nating magsalita, kaya nating maglakad, kaya nating kumain na gamit ang ating mga kamay, kahit may nararamdaman na tayo, wala talaga hindi natin iniisip na dumalaw sa pinakamalapit na health center. Especially na nagkaroon ng pandemic, natatakot sila na baka yung kanilang simpleng ubo, trangkaso ay i-consider na COVID o COVID probable case, ganun. Kami sa community, sinisimulan siyempre yan sa family. Oo. Kami sa family namin, sinasabihan ko na kapag meron kayong nararamdaman, huwag nyo nang hintayin lumala. Pumunta agad tayo sa pinakamalapit na health center. Walang masama na inuna natin yung pagpunta sa mga doktor na ang hawak ay plato, kandila at konting mantika na nagdo-drawing ng cross. Pero mas mahalaga pa rin na pumunta tayo sa pinakamalapit na health center. Ganun yon. And pagdating naman doon, since nagkaroon kasi ng surge Kebs ngayon sa Albay, so ang ating Bicol Regional Training and Teaching Hospital ay exclusive siya for COVID patients and COVID probable patients. So yung provincial hospital naman kung saan doon ako ngayon nagvo-volunteer ay exclusive siya for OB, sa mga OB-related cases, sa mga aksidente, tsaka yung PEDYA ay nilagay naman dito sa Legazpi City Hospital. So alam na nila na kapag ikay diniretso sa BRTTH, ikaw ay malamang COVID probable. Pag dinala ka doon sa amin sa Josefina Belmonte, it's either manganganak or na-aksidente or operahan. Or pag dinala ka naman sa Legazpi City, ikaw ay bata kasi exclusive for PEDYA yung hospital ng Legazpi City. And yung Bicol Regional ay exclusive siya for COVID na as of na, nag-start siya noong September 15. Pero mahalaga pa rin na simpleng ubo, sakit ng ulo, pagsusuka at pagtatae, wag po tayong magdalawang isip na pumunta sa pinakamalapit na health center. Lalong-lalo na kung hindi tayo bakunado. Kasi nasa huli din yung pagsisisi. Ganun lang yun. Nasagot ko ba yung
Thank you.
tanong?
Thank you. Actually kasi problema talaga yan, Binibining Rufa. We understand na ganun talaga nangyayari yun. And
Kasi Kebs, natakot kasi yung tao talaga ngayon na pumunta magpa-check up, even sa circle of friends. Di ba nung pag-uwi mo dito, nagkukwentuhan tayo na yung mga ubo, di ba yung usually before the pandemic, pag umubo ka, walang courtesy sa katabi mo, uubo ka lang, ganon, di ba? Pero ngayon yung ubo, ganon na yung ubo. Kasi nga,
lalo sa airplane, ma'am, lalo sa airplane. Diyos ko, itatago mo ang ubo mo hanggat kaya.
di ba? Ganon yung tao. So, kailangan ibalik talaga sa tao na hindi kalaban yung hospital. Huwag niyong ang isipin na ang mga doctors, ang mga naka-duty doon sa isang district hospital ay judgmental kasi meron mga pinagdadaanan na proseso. And may proseso din pinagdadaanan like meron tayong triage. Sa gate pa lang, may triage na. Isi-separate naman yung mga clean case, tapos doon sa mga medyo may travel history, may nararamdamang pag-uubo. Tapos pag ano, may mga policy kasi ngayon na pag i-a-admit yung patient ay irarat muna siya, Kuya Kebs. Ira-rapid antigen test muna. Oo. Yung
At
patient lang ha.
idagdag ko din ma'am, ano yan? Kapag ina-assess ka, huwag ka magsisinungaling. Sabihin mo
Yes,
yung totoo.
true.
It makes things worse.
Yes, I also encourage everyone na during interview doon sa triage, please kung merong travel history, hindi ka nga nag-travel pero yung kapatid mo, yung ate mo, yung kuya mo ay may pinuntahan, sabihin kasi kawawa naman pala yun nga yung question natin ngayon, Kuya Kebs, kung gaano ba ka-accurate yung sistema ng contact tracing kasi pwede naman magsinungaling. Like for me, ilang beses akong na-quarantine, ilang beses din ako nakasama sa mga ang direct contact. Tapos nakita ko sa listahan wala ako pero kausap niya ako nung the other day. So I insist na ilista niya ako, paswab ako, magpa-quarantine ako para hindi lang para yun sa'yo kasi sa akin parang hindi na ako magigilty kung sakaling mag-positive ako kasi tanggap ko na. Pero yung mag-positive yung mga malalapit sa buhay ko and then yung buong community ko ay yun yung nakakatakot. Mm. Okay.
Totoo yan. Yes, I agree.
Oo.
There is a question here raised for everybody, like for the speakers. What inspired you to be an advocate or to do what you are doing, and what are the challenges you face while doing this? Maybe we can start with Sir Freddy.
So, ano yung question ulit? Sorry.
The question is, what inspired you to be an advocate or to do what you are doing, and what challenges do you face while doing this?
Okay, so what inspired me? According to, well, theoretical ang sagot ko. According to Habermas, may tatlo daw na motivation ng isang tao. Una is may altruistic, basta the last part is altruistic or the last reason is altruistic. Meaning, it's a way to do good. It's a way to express goodness to other people. And primarily, that is my reason for engaging into this kind of work. Kahit walang bayad, mahirap. Mahirap talaga kasi the stresses that we absorb and all. And we also encounter yung yung possible stigma din na bakit we engage into HIV work, siguro HIV positive ka din. So that is not always true. Yun. So challenges, ano ba yung challenges ko pa? Pero yung feeling ko yung pinaka-bongga talaga na challenge ko is really the stress of thinking about yung mga clients na nag-lost to follow up. Somewhat we have invested emotions then, and we give off ourselves. We offer ourselves to them, and it's also hard on our part. Yun. I think I hope I answered the question. Thank you.
Thank you, Sir Freddy. Now, Rufa.
Yes, paulit po ng question, sir.
Why? Charot, Miss Universe question. What inspired you to be an advocate or to do what you're doing, and what are the challenges you face while doing this?
Okay. Well, Sir Kebs, growing up kasi na masyadong parang at a very young age na involve ako sa isang organization working for the community. Pero at that time, nung bata ako, ang inisip ko lang ay parang maghanap ng sense of belongingness. So, yung makakasama ko na same yung thoughts, same yung mga gusto namin sa buhay. At nakuha ko siya sa isang organization. After a year, na-realize ko na parang hindi lang kasama yung kailangan ko. Parang kailangan ko talaga mag-emerge or i-engage ang sarili ko sa community. Kasi ang dami ko based on the personal narratives ng mga fellow LGBTs, especially na mga transgender sisters ko, ang dami-dami nilang na-experience na hindi makataong treatment uh, towards them, like sa family, paglabas ng bahay, sa community, and even doon sa ating mga um, health, ano tawag dyan, sa mga facilities, health facilities, na kung saan hindi sila maka-access ng basic healthcare services dahil sila ay iba doon sa mas nakakarami. Kaya ang sabi ko sa sarili ko, kailangan makabuo tayo ng mundong we don't have to look the same. Parang hindi natin kailangan magmukhang pare-pareho. We just have to treat each other the same. So kaya yun yung motivation ko talagang, we don't have to look the same, but we have to treat each other the same. So, yun yung motivation ko na kung bakit pinagpatuloy ko yung community service. Kasi alam mo naman, di ba, wala naman yung mayaman sa community service. And most of the time, mga volunteer yung pinagagawa natin pag may, hindi na nga siya, di ba, sa volunteerism, pag may extra time ka. Ito ang ginagawa na minsan ay full-time na parang, kasi kailangan mong, ito yung gusto mong mangyari, kailangan mong gawin yung mga bagay para ma-achieve mo yung pinapangarap mong lipunan para sa lahat, na walang lugar for discriminations, isang mundong o isang community na ang malaya kang nakakapunta sa mga health center na hindi ka ginajudge based on your sexual orientation, gender identity, and sexual orientation. Mm-mm.
Miss Universe na Miss Universe.
Next, next
Pwede bang
question.
dagdagan?
Sige po,
Pwede
Sir
bang
Ted.
dagdagan ko yung sagot ko? Yun nga, yung sabi ni
Bakit?
Habermas,
Oo.
ang reasons for people na to engage into a certain activity is, number one, improvement of knowledge. Number two is understanding of the self. Like Miss Rufa, yung sense of belongingness. And it's also my way of understanding myself by identifying to a particular group of people. The question is, bakit kami nag-engage into this kind of work? But we should ask why we sustain, why we still continue to work here. Yun. It gives fulfillment, really, a genuine fulfillment that the fulfillment that we get from this service kahit wala kaming nare-receive na remuneration and what.
True, Kev.
And I also like the friendship that I gain. I see the people are very positive, very straightforward, and parang no nonsense. I appreciate that. These people are true, as in genuine talaga. And si Sir
Grabe
Kev
kayo.
sabi, ano yun?
Grabe kayo.
sabi niya,
True, Kev.
sabi niya, nag-umpisa lang kami as ano yun, mga magkasabay-sabay sa seminar, pero eventually it led to the development of a lasting friendship. So that's also another way of looking at this question.
True. True,
And
Kev.
if I can remind, actually, full disclosure, we are friends for like a decade already. We started.
Ayan na naman siya.
Ayan, wait lang. Kasi magandang basis to dun sa
Reminder.
question eh. I hope it can
Sige, sige,
inspire
sige.
other people too. I remember it was in 2012 when we started, meeting up and talking about issues, and parang from our own point of view, trying to raise recommendations out of nonsense. Parang we were very young back then. We don't know much about the world yet. But I remember clearly that parang we were in sync, that we wanted to create a friendly, safe, and livable albay. If you can remember that, those three clauses, friendly, safe, and livable albay. I think I always I always remember those three words na parang somehow also brought us together and we thought of how can we do as young people back then, as youth active youth leaders no nung time na yon 10 years ago. Paano nga tayo magiging part ng solusyon to make Albay as a livable, friendly, and safe for everybody, especially for our fellow youth? So if you remember that, and then we started going to adolescent reproductive health, HIV as an issue. We find spaces ourselves in our own capacity on how to bring our
Pagin
own
tayo sa
opinion and
pagpasalang
thoughts, di ba?
reproduction.
So, so bongga talaga. So I think ang isang inspiration ko is you guys. So those people you meet actually na parang same sound perceptions or principle that you share, and you see them doing will also drive you to move forward. So my inspiration in this kind of work that we do right now is the people I meet and the stories I hear from them. And ano ang mga challenges? Ang
True,
dami.
Kevs.
Ang daming challenges sa totoo lang. Like yeah,
Ayan.
the government itself is a challenge. The people we meet, the who want to stay apathetic, no? So that's also a challenge. The people
Parang yan,
who ano yun, Rufa?
parang yan, Kevs, yung second question, yung challenge, na hindi
Yes,
ko
oo.
nasagot. Oo.
Oo. Eh paano kasi puro ka wins?
Ay,
So yon. Anyway, kasi medyo short na tayo sa time, guys. I'd like to entertain one more question. There's actually two more questions. The first question is about the project of your organization you're most proud of. Let's skip this and I'll tell something a bit about it later. That the second question here on my list is if you want to be a volunteer to activities of this organization, maybe GM or gayon, can we join or volunteer in your activities as a student? Do you have answers to that? Sino muna mauuna, Rufa?
sure. Joke lang. You can visit us. Visit niyo yung page ng Gayon and ng Gentleman, and very welcome. Alam mo, very welcoming naman yung organization namin, especially sa mga young people na gustong makatulong din sa kanilang kapwa young people and for the community. And kanina kakatapos pa lang nung dalawang interview from Bicol Universities, kasi parang ang studies nila yung community involvement ng organization. So,
as member ng city project.
so wini-welcome namin lahat ng gusto as long as they have the courage and the willingness to share and to help the community. Oo. Kasi 'di ba, Kevs, yung framework baga natin, yung care, alam mo yung care, yung
Sige
community,
nga.
oo. Pero di ko na-elaborate yung community, accountability, responsibility, and empathy. Yan yung framework of ano natin, care. Oo. Maganda ba? Pang Miss Universe.
Winner. Yes, Sir Ped.
Of course, just like what Binibining Rufa said, we welcome na yung fresh ideas, fresh na, ano yun, na energy na papasok sa aming organization. But usually we do it, we open our membership at the end of the year. So you might as well contact us at the end of the year when it's open for admission for members. And we make sure naman that you will be trained to take care of our clients and to prepare you with the work that will face you. Kaya ba? But yes, we will try our best to mentor and to ensure that you are prepared with the work that you do here.
True. Walang requirements, Kuya Kevs,
Okay.
ha? Walang requirements. Oo. Kasi we welcome mga new and brilliant ideas. Kasi siyempre, 10 years ago, medyo ano na din yung yung ating ideas. Kailangan ng mga fresh, sabi ni Cotton Peddy. Kailangan nila maging adaptive to the change of time. And responsive
agree.
to the needs
I
of
agree.
time.
Responsive.
And we also need new blood. Like we are already on our 30s. 30 exactly kung ano, secret na lang yun. But
I'm
of course,
27.
wow, brave. No, so importante din na
Age
na
is
talagang
just a
may
number.
participation. Yeah. And GM Bicol is also open for internship. So we actually accept student interns. So if you want to get our access to our GM Academy, we provide a lot of leadership and capacity building training. Libre naman 'yon kapag halimbawa member ka. And we also offer it at a very cheap price, yung mga intensive courses also. Pero hindi namin pinapublic masyado kasi ayaw namin ng quantity. We go for quality in terms of instruction and product or output ng mga trainings. So yon. I think it's part of my assignment to do a synthesis of what happened today. And this will be the last part. So no worries. Ayan. So at this point po, I'd like to focus on the discussion and it really translate into well-being of people, especially there is a very big role of public health workers, community organizations pagdating sa well-being ng tao. And I want to focus on few questions on how to synthesize what happened this afternoon. When we talk about well-being, I think the common question there is masaya ka ba? Like, if you answer this question, masaya ka ba? Exactly, paano ka masaya? You can access health services. Can you do that? Do you have health information that you need for you to decide responsibly on your own? Ikaw ba ay may access sa equitable social services? Ikaw ba ay nade-discriminate or hindi? Kamusta ka exactly? Ikaw ba ay nakakakuha ng maayos na edukasyon? May opportunity ka ba matuto? Tama ba ang information na nakukuha mo? Ikaw ba ay nagugutom? Yes or no? So feeling ko these few items here that I listed, if you can answer this as yes, 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 then more or less yung well-being mo is okay. But in the context, no, in the context of reality, especially in the middle of pandemic, especially if your issue is HIV, if your issue is along the lines of key affected population like young people, people na nasa laylayan, nasa LGBT community, no? Ano ang level ng well-being mo? Gaano ka kasaya? So I think the lesson of this afternoon session, if I may adopt Tanahill's health promotion model, it's very important that we work on the aspects of health education, which involves a lot of really informing people about aspects on health and their rights so that they can be empowered. That way, informed population can also help in strengthening systems, no, in order to prevent health crisis, especially worsening situation like teenage pregnancy, increasing HIV, and so on, including COVID-19. And then health protection wherein we saw in the presentation that there should be policies, programs wherein dapat kasama ang community, ang nasa laylayan in the discussion. So I think no, for health promotion, it's very important that we consider all these aspects as we try to adopt Tanahill's health promotion model so that we can really improve well-being of people. So maraming salamat for joining SaluDamayan webinar series, and this is only the session 1. We have session 2 upcoming this coming Sunday, next Sunday, which is focused on understanding the HIV situation in the Philippines and ways to move forward. And key discussions are, anong itsura ng HIV ngayon sa bansa? Ano ang behavior ng HIV transmission? So we will get a lot of inputs and updates here and other recommendations, no, as which will be coming from a notable key person along the lines of this issue. And important mechanism which is also part of health protection is kamusta ang Philippine HIV and AIDS Policy Act na dapat yun naman ang nagpo-promote at nagpo-push ng health protection if we want to adopt the model which I just showed to you earlier. So at this point po, ladies and gentlemen, I would be sharing an exit pass. This exit pass will serve as an attendance. At the same time, hopefully it will it will also be used for us, no? It will also be used by the GM Academy to prepare certificates for you and how to send it to you guys. So ngayon po, ayan, I've shared the link to the exit pass. everybody can just open it siguro or do it later. But of course, if we end the session, no, you will also lose the access to the link. So I would appreciate if you can go to the link right now. Now po, if it's okay with you, this is a safe space. I will now stop recording.